Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Naloxone. Its brand name is Narcan. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Naloxone is an opioid antagonist with high affinity for the mu receptor. It acts by competing for the mu, kappa, and sigmoid opioid receptors in the CNS. In terms of indications for use, naloxone is indicated to be used in the treatment of known or suspected opioid overdose, and it can also be used for reversal of opiate activity in respiratory depression. Now, before somebody was to use or to be given naloxone, there is a contraindication that they must clear, which in this case would just be a hypersensitivity to naloxone or any other component of the product. And there's also some precautions and warnings that they should be made aware of. After initial symptomatic improvement, CNS depression may return. So after the dose of naloxone is given, the patient must seek medical attention. Aside from CNS depression, respiratory depression, if that's what we're treating, may also return after the dose of naloxone is given. So as the previous situation mentioned, patients in this situation would also need to seek medical attention. Agitation has been reported with excessive doses of naloxone. It should be noted that this medication cannot be used to treat respiratory depression if the cause is non-opioid related. Patients with a physical dependence to opioids who are given naloxone may experience acute withdrawal symptoms. Newborns of mothers who are suspected to be using opioids long-term should not be given naloxone because there's an increased risk of experiencing withdrawal and seizures. Now, once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to take or be given naloxone, they can expect to receive their dose intravenously or through a nasal spray. So if somebody is using the Narcan nasal spray to treat a suspected opioid overdose, they would typically use or be given one spray in one nostril. The dose can be repeated every 2 to 3 minutes if necessary, and a new nasal spray should be used for subsequent doses. Now, aside from the nasal spray, if somebody is using the intravenous solution, they would typically be given 0.04 to 0.4 milligrams intravenously. Now, if somebody is using naloxone to treat respiratory depression associated with opioid use, they would use 0.1 to 0.2 milligrams intravenously. The dose can again be repeated every 2 to 3 minutes until the desired reversal is achieved. As with all medications, there are some side effects or adverse reactions that patients may experience while using naloxone, so I'll go over some of those here now. Some patients may experience redness at the injection site, and some patients may also experience dizziness or a headache. Now, some more serious side effects would be hypertension, high blood pressure, hypotension, low blood pressure, or tachycardia, a rapid heart rate. Some patients may experience nausea or vomiting, and seizures, a tremor, and opioid withdrawal are also possibilities. That's all we're going to talk about today with naloxone or Narcan. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.